Can you get an allergic reaction from the clothing that you wear? That's the video we're starting out with today, and I've got a bunch of other great TikTok videos to react to. I'm a board-certified dermatologist, Dr. Dustin, and as we watch these, I'm trying to teach you a little bit about how to take care of your skin, the good, the bad, and the ugly of everything that's on TikTok. So let's dive in with our first video and see if you can be allergic to your clothing. All right, here's one of the many reasons you should not shop at Shein. She's breaking out in a rash all over after trying on clothes from Shein. Ooh, this looks bad. It looks very itchy. So in synthetic fabrics, some of those are treated with chemicals, and it is possible to be allergic to them. There are types of chemicals that are known as formaldehyde-releasing chemicals. Yeah, formaldehyde, the stuff that you would embalm a body with. Now, at low concentrations, this hasn't really been shown to be harmful to people, but it certainly is something that you can be allergic to. So if your immune system detects that, you can react, you can get a rash, it's going to be itchy, and you can't wear those types of fabrics. So that is something to be aware of. And of course, I just don't generally like the idea of formaldehyde releasing chemicals, even if it's at super low levels. All right, we have a high frequency wand here. So this high frequency wand uses argon or neon gas to generate an electric current. This is supposed to kill the bacteria that cause acne bumps because it creates ozone in the area. It creates a little bit of heat. There's really not a lot of data to show that these are clinically helpful, so I don't recommend them, but when they film it like this, it sure looks cool, and it's tempting to buy it and try it, but I recommend sticking with the tried and true ways of treating your acne with the right types of topical products. Sometimes oral medications are needed, and I strongly recommend good sleep and a healthy diet. Avoid processed foods, and that is going to make you feel better and help your skin. All right, we're going after some ingrown hairs on the beard line, poking in there and popping that out. I like these tweezers, that's a good tool. We're not using any gloves. Probably a scenario of like the girlfriend treating the boyfriend. Can we go in there and pop this little pimple and get the ingrown hair out? Boom. He's very patient. Doing a good job here. Again, gloves. I recommend it, but here we are at home, just plucking hairs and popping pimples. Boom. Getting them. Well done. Got a lot of irritation and shaving bumps on the neck. Exfoliate that. Warm compresses before you shave. All of those types of things are going to be helpful here. Boom, popping it out. All right, good job. Oh, I've been excited to show you guys this one. This is a mask pore strip. So it's not just the nose, but it's over the cheeks as well. And look at all of these sebaceous filaments that are coming out of here. There are some blackheads as well. Some of these bigger ones are definitely blackheads. I want to know what product this is. Even though I don't strongly recommend these, I would do it on myself. I want to see this stuff come out. Without the right skincare routine, they're going to get more blackheads. The sebaceous glands, sebaceous filaments are going to keep doing their job. But look at that. Very impressive. Okay. A lot of congestion in the cheeks here. You can see that edema, that swelling. And so they've got a lot of activity of the sebaceous glands. I would make an attempt to treat this person with medicines that would decrease the inflammation in the skin, and that's really going to help them on this acne. But they can just push about anywhere and they're getting tons of stuff out. And again, this is a lot of activity of the sebaceous glands. This particular treatment is going to cause its own trauma and inflammation, and I don't think it's going to get to the root cause of why this person's skin is so inflamed. But it is satisfying to watch. Really fun to see all that stuff come out of there. So what would I do for this patient? Well, some anti-inflammatory supplements and sometimes antibiotics. I recommend turmeric if somebody doesn't want to take antibiotics. Doxycycline is the most common antibiotic to help decrease inflammation in the skin. And in tough cases, Accutane will also help. But there's not a ton of acne here. I don't know that Accutane would be my go-to, but fun to watch. Now this says stretch mark removal. A lot of times we'll use lasers or microneedling to improve the look of stretch marks, but this is a cosmetic tattoo where the tattoo artist is camouflaging those stretch marks essentially by getting the ink color that matches the patient's skin tone and then essentially tattooing that in there so you don't have that white stretch mark. It just looks like the normal skin. But I'm not sure where this one is going. It says the art, and we clearly have a rash on the skin. It looks like a ringworm. Oh, the artist is the cat. It makes sense now. Get your pets clean, treat them appropriately. All right, my dad insists that these are freckles. These are huge blackheads around the eyes and the nose. This is a condition called Favre-Rocochat disease, and it's from intense sun damage that damages the collagen, so the pores get all plugged up. And look how much stuff is coming out of there. I'd like to see a zoomed out view and see how much stuff is actually coming out, but satisfying case. Me every second of the day because I have hidradenitis suppurativa. This is an auto-inflammatory condition that leads to cysts and boils underneath the armpits as the most common spot, but some people will get it under the breast, in the groin, on the buttocks, and it's a devastating condition. Of all of the things we treat in dermatology, it is one that has some of the biggest impact on quality of life. So people with bad psoriasis don't even feel like their life is as bad as people with moderate to severe hidradenitis. There are medicines that are approved to treat this. Overall, I recommend living the cleanest, least inflammatory diet style life that you can, but when medicines are needed, it's best to seek out treatment with a board-certified dermatologist to find the protocol that's going to work best for you. All right, they are doing the carbon laser peel on the back of somebody's neck. So that intense pigment is actually a carbon lotion that's put on the skin, and the laser is targeting that carbon. This heats the tissue, it helps even out skin tone and pigmentation. They probably have a little bit of acanthosis nigricans on here, but this can help to just improve the texture of the skin. It's a low downtime procedure. Results are kind of mild to moderate. This is not an overnight cure for anything, but it's a very satisfying procedure to watch. I can tell you right now, remove freckles simply. This is going to be fake. They're putting on a little hyaluronic acid serum and they're wiping it off with a Q-tip. This doesn't work on freckles and moles. That was a makeup dot that was put on the skin. Don't fall for these things. It is a waste of your money. It's not safe if you're trying to remove moles at home. All right, we have tons of blackheads on this person near the nose. This could be a condition called Favre-Rocochat where you get intense solar elastosis or sun damage and you get huge blackheads that just don't want to come out. But they do pop out really easily. But in order to really fix this, we would need to do some aggressive laser resurfacing. So this is really satisfying to watch. They come out easy, but there's some serious treatment needed here. Let's look at this laser surgery results. Why does she have bruises on her face? Well, she has a vascular birthmark in the face, and they use a pulse dye laser that targets hemoglobin, or the blood, in those blood vessels to heat them up and break the blood vessels so that they can heal. When you use higher energy levels with that laser, though, it will cause bruising on the skin. And in fact, you actually need to get to that point of bruising in order to see results. You can see by the end she's well healed, and this sometimes takes more than one treatment in order to get the best result, but we've made great progress so far. All right, this says ringworm check. So this is a fungal infection. When you have ringworm, it's actually a fungus on the skin. We call it tinea corporis, or ringworm of the body. Topical treatments are often enough to get rid of it on the body, but if it's in an area of hair, like on the scalp or in the beard of men, and the fungus creeps down the hair follicles, you're probably going to need oral medication to treat it appropriately. All right, me chilling with this birthmark, never wearing sunscreen in high school. Let's see. My dermatologist, yeah, that's going to turn into melanoma if we don't treat it. Gets chunk taken out of leg. So I don't know what the diagnosis was here. He said it could turn into skin cancer. So maybe it was a dysplastic mole, meaning it was not melanoma yet, but it wasn't entirely normal. So that's why they did the biopsy and then the excision. We don't know just from the video what the actual diagnosis was, but it was apparently important enough to cut the whole thing out. All right, we have got some sebaceous filaments on the nose, not even seeing a lot of blackheads, and they're using a pore spatula. You can hear the ultrasonic frequency vibration there to help loosen it up and push that stuff out. You do have to apply a fair amount of pressure with these. I've had it done to me. It's not super comfortable. It can cause a little trauma on the skin, so I don't generally recommend them. There are a few smaller blackheads there. Most of these are sebaceous filaments. Using a retinol, using salicylic acid is going to help your skin look as good as possible. And if you want to do this once in a while, you can. Just don't go too aggressive on it, because you can damage the skin and break blood vessels, and that part's not fun. So now we know you can be allergic to your clothes. Be careful of the chemicals that you're putting on or around your body, because that can be a problem. And then some really fun ones that we reacted to. Hopefully you learned a little bit about how to treat congestion and inflammation in the skin. If you guys have questions about any of these, make sure to leave them in the comments. I'll try to get to them, or maybe make additional video content. I want to let you guys know about my other channel at Dr. Dustin Portela. I'll have a link down in the video description. That's where I do strictly educational content and content around my mobile clinic. I have a motorhome that I go and I treat people for free if they can't afford dermatology care. So uninsured, homeless, rural patients and communities. So we go out and try to do some good in the world. And you, when you watch these videos, like, comment, or subscribe, or make any of your skincare purchases from the links down in the video description, it helps support that cause that's near and dear to my heart. So I can't thank you enough for being here. I'll see you guys on the next video.